Good morning. Today we continue discussion about pathomorphology of different disease, and we will talk about atherosclerosis, arteriolosclerosis, ischemic heart disease, hypertension, and atherosclerosis. Also, before discussion about this topic, we must remember about book USMLE Step 1, where present any short information from different topics. Please read this book and study material from this book too. Also, atherosclerosis and arteriolosclerosis. Definition. Atherosclerosis is a chronic disease which arises up as a result of violation of fatty and albuminous exchange. On atherosclerosis is various combinations of change of internal membrane of arteries, which show up as a focus laying of lipids, difficult connection of carbohydrates, elements of blood and circulation in it matters, formation of connecting tissue and laying of calcium. Also, this is a complex change in wall of vessels by atherosclerosis. Atherosclerosis damage vessels elastic and elastic muscular types. After prevalence, illness occupies the first place in cardiovascular pathology. Lately, it collected character of epidemic, especially among the citizens of highly developed countries. It is much mainly for people of mature age after 30-35 years. Etiology of this disease. It is a polyetiologic disease. There is plenty of risk factors which are instrumental in increase of level of atherogenic lipoproteins in blood and to penetration of them in the wall of vessel. Arterial hypertension, diabetes mellitus, obesity, hypokinesia, smoking, hyperlipidemia and dyslipoproteinemia, inherited inclination, age, sex, more frequent myths for men, psycho-emotional overstrain, and etc. There are the following theories of development of atherosclerosis. First, infiltrative theory of Untitled. Second, nervously metabolic theory of Mesenteria, immunological theory of Klimo and Nahornov, viral theory, today very important, gerontology theory of Davidovsky, thrombogenic theory of Rokitansky. Pathogenesis of atherosclerosis. Pathogenic essence of atherosclerosis consists in the focus laying in intima of arteries of so-called atherogenic lipoproteins in reply to the damage of endothelium. Atherogenic lipoproteins are considered to be lipoproteins of very low and low closeness, which contain the large supply of cholesterol, 245%, and little albumin. Lipoproteins of high closeness opposite a protein 55% and comparatively little cholesterol have much 16%. They execute an anti-atherogenic function that prevents development of atherosclerosis. Pathological anatomy of atherosclerosis. In development of atherosclerosis, select 4 stages: Prelipid, stage of lipid spots, stage of fibrosis plaque, and stage of complicated defects. For example, ulceration, calcinosis, thrombosis, bleeding, and other. Prelipid stage, first stage, is characterized with such process as a loss of glycocalyx protective polysaccharide layer of endotheliositis, expansion of intraendothelial cracks, activating of endocytosis in endothelial cells, intima swells up, in subendothelial space begin to penetrate lipoproteins from plasma of blood and growing amounts. Lipoproteins of high closeness counteract connecting of macrophagocytes into foamy cells. They easily penetrate at intima, saturated cholesterol, and similarly easily go back into blood. Macrophagocytes have on the surface specific receptors for lipoproteins of high closeness. Prelipid stage have other signs. Another characteristic of morphological feature of atherosclerosis is proliferation of cells of smooth muscles in intima of vessels. Myocytes migrate here from the middle membrane of arteries media under act of factors of chemotaxis, and reproduction of them depends on the factors of growth, thrombocytic, fibroblastic, endothelial. Without regard to absence of scaffolding receptors, they acquire property to take in more defeat lipoproteins and accumulate either of cholesterol. Foamy cells appear also from them. A second stage of lipid spots. Lipid spots or strips appear in the different departments of the arterial system, but before in all in aorta. From cellular elements, foamy cells, T lymphocytes, and fibers of smooth muscles prevail from them. On this stage, as of cholesterol are mainly in cells. Around there is insignificant exchange of connecting tissue. Lipid spots do not hinder a bloodstream. Foamy cells overload cholesterol, collapse in course of time, and cholesterol is output in out of cellular space. The accumulation of foamy cells and out of cellular lipids between elastic fibers make light intima. Glycosamine glycans are put aside in hemoglobin, fibrin. Stage of fibrosis plaque. Fibrosis plaque consists of amorphous mass, which tailings of elastic and collagenous fibers, cholesterol enter in the complement of foamy cells are not blasted. If in plaque the process of disintegration prevails with formation of necrotic masses, such plaque was named atheromatosis. Tissue detritus, which is included in the complication, means maintenance of retinosity oil gland atheroma. Foamy cells, lymphocytes, plasmacytes, new formed vessels accumulated on periphery of plaque. From lumen of vessel is marked of hyalinized by connecting tissue. Overlay of plaque. Complication begin from this stage. Also stage of complicated defeats. Ulceration, calcinosis, thrombosis, hemorrhage, rupture, and other. Ulceration of plaque is also the frequent enough phenomenon. An ulcer has unequal edges. The bottom of it is formed by muscular layer or adventitia. The defects of plaque are often covered by blood clots. If atheromatous muscles get in a bloody riverbed, they become the reason of embolism of brain and other organs. In this picture, you can see morphological, histological signs formation atherosclerosis plaque. This microscopic cross-section of aorta shows a large overlying atheroma. Cholesterol cleft are numerous in this atheroma. The surface shows ulceration and hemorrhage. Despite this ulceration, atheromatous emboli are rare, or at least complications of them are rare. Another complication of fibrous plaque is lumen atherosclerosis. This process is complete of atherosclerosis. Salts of lime are put aside in atheromatous masses, fibrous tissue and intermediate matter between elastic fibers. Plaques collect stony consistency. The focus of calcinosis are localized mainly in an abdominal aorta, coronal arteries, arteries of pelvis and thighs. Clinic morphological forms of atherosclerosis. Depending on localization of atherosclerosis in it, that or other vascular pools select following clinic morphological forms. First, very often, atherosclerosis of aorta. Second, too often, atherosclerosis of coronary vessels of heart. Third, atherosclerosis of arteries of cerebrum, too very often. Atherosclerosis of arteries of kidneys, atherosclerosis of arteries of intestine, atherosclerosis of arteries of lower limbs. On this picture, macroscopically signs atherosclerosis of aorta. On preparations, especially determined all of stage of atherosclerosis: yellow spots and ribbon, fibrous plaque, atheromatose, ulceration, sclerosis and calcinosis. At the initial displays of atherosclerosis, yellow spots and ribbons, aorta is not deformed. Intima is yellow. Pay attention that yellow spots and ribbon located mainly near places of origin of arteries. This is histological signs, morphological change in wall of aorta by atherosclerosis. This high magnification of the atheroma shows numerous foam cells and an occasional cholesterol cleft. A few dark blue inflammatory cells are scattered within in atheroma. These two macroscopically signs atherosclerosis of aorta. Yellow spots and ribbon located mainly near places of origin of arteries. At presence of atheromatose, the internal surface of vessel has an unequal kind as a result of presence of pleural yellow explorations. Most atheromas had character of ulcers. Atherosclerosis of aorta thrusting out of yellow corresponding to atheromas, white as a result of development of connecting tissue. Atherosclerosis. Most atheromas had character of ulcers. Such ulcers of internal surface of aorta are the place of formation of blood clots and can be the source of thromboembolism. This macroscopically picture formation atherosclerotic nephrosclerosis. A kidney is dense, surface of largeness, with pleural involvement and presence of the thin-walled cysts. This macroscopically picture present signs formation one complication as aneurysm. Here is an example of an atherosclerotic aneurysm of the aorta in which a large bulb appears just above the aortic. Most such aneurysms are conventionally located below the renal arteries, so that surgical resection can be performed with placement of a Dacron graft. These two macroscopically signs formation of aneurysm. This large abdominal atherosclerotic aorta aneurysm below the renal arteries at the right and above the bifurcation at the left has been opened to reveal abundant layer thrombus within the aneurysma. In this macroscopically signs complication by atherosclerosis, where formation such complication as infarction of spleen present in this picture. And this macroscopically signs complication of atherosclerosis of intestinal vessels, where formation gangrene of thin bowel. Wall of bowel is black. In transparent vessels, which blood supply bowel, are evidently red obturative blood clots. These two continue signs complication by atherosclerosis, formation gangrene of intestine. Pay attention to the change in the color, surface of intestine, extent of necrotic tissue texture. This presents normal color of intestine, and this present signs formation gangrene because wall of intestine have black color. It's necrosis. In this macroscopically picture, we demonstrate formation of atherosclerosis of mesenterial artery. Atherosclerosis of mesenterial artery with an obturative thrombosis. Very often outcome such change in intestinal vessel formation, such complication as gangrene of intestine. These two present one complication of atherosclerosis, where formation gangrene of foot at atherosclerosis of vessels of lower limbs. On the skin of foot, the area of black is especially determined with maceration. Such change in tissue of foot arose as a result of stopping of blood supply, which is complication of atherosclerosis of arteries of leg. Second disease, what we will discussing today, is hypertension illness or essential hypertension. This is a chronic disease with the protracted and proof increase of arterial pressure. But in clinic very often you can see symptomatic hypertension. This pathology rises up as the disease of nervous system, kidneys, vessels. Distinguish also types of symptomatic hypertension developed by kidney pathology, nephrogenic hypertension or renovascular hypertension, by endocrine pathology, illness syndrome of Fitzenko-Cushing, a second aldosteronism, chromocytoma, pathology of nervous system or neurogenic symptomatic hypertension after trauma of brain, tumor brain, abscess, hemorrhage in the cerebrum, defeat of hypothalamus and brain. By vascular pathology, coarctation of aorta, other anomalies of vessels, polycythemia. Etiology and pathogenesis of hypertension disease. Fully is not found out. Important place is in the origin of illness, taken disorders of elevation of vascular tone, Lang-Masnikov theory, is illness of unreaction emotion, and also suppose use of kitchen salt in a meal, which is combined with genetic propensity to hypertension. It is possible to select among the mechanism of development of hypertension illness: nervous, reflex, hormonal, kidney, inherited. All of influencing which are able to promote the cardiac troop glandin or peripheral resistance, or the first and the second simultaneously, can be considered the etiologic factors of hypertension illness. Two major such belong from them: increase of volume of plasma, increase of cardiac troop glandin, hyperactive of The sympathetic nervous system, violation of kidney functions. Sympathetic hyperactivity is one of the strongest factors of development of essential hypertension. This state affects function of some organs which can be considered to be targets of sympathetic influencing. Except for heart, arterioles, veins and kidneys belong here. The pathological anatomy of hypertension disease depends on its motion, which can be of high quality and malignant. Select 3 clinic morphological stages: preclinical or transient, stage of widespread change of arteries, or organic, at the stage of second change of organ. The transient functional stage clinically shows up the periodical increase of arterial pressure, and morphologically by the hypertrophy of muscle layer and hyperplasia of elastic structure of arterioles, spasm of arterioles, and moderate compensate hypertrophy of the left ventricle of heart. And this macroscopically signs of compensative hypertrophy of left ventricle of heart developed by hypertension disease in first stage. Stage of widespread change of arteries is characterized by constantly promoted arterial pressure. Walls of shallow arteries and arterioles are in a state of proof reduction and hypoxia. The penetrating rises, plasma impregnates the structures of vascular walls, plasmarage, and the last are destructed. Elements of destruction and also protein and lipids of plasma are eliminated through a wall by resorption, but it as a rule is incomplete. The result is development of hyalinosis and atherosclerosis. A vascular wall is thickened and the lumen of arteriola becomes narrower. In large arteries, unlike the change of arteriola described higher, elastofibrosis develops and atherosclerosis. Elastofibrosis is compensate answer for proof hypertension as hyperplasia and breaking up of internal elastic membrane of vascular wall. Development of atherosclerosis is related to destruction of vascular wall, accumulation of cholesterol, and promoted arterial pressure. The typical clinic morphological display of this stage is a hypertrophy of left ventricle of heart and also dystrophy and necrobiosis of cardiomyocytes. Is very important. In second stage, in heart present hypertrophy of left ventricle of heart and dystrophic necrobiotic change in cardiomyocytes, and results this change formation cardiosclerosis. Stage of second organ change is characterized by destructive atrophy and sclerotic change of internal organs. Heart. There is diffuse small focus cardiosclerosis in the hypertrophied myocardium. In kidney, atherosclerotic nephrosclerosis develops or initial wrinkling kidneys which are symmetric, diminished hair dense consistency with shallow tuberositas on the surface, thickening of cochlea on a cut. At a microscopy, the bulk of apparent arterioles appear with expressed them by hyalinosis. Glomerulus of sclerosis and hyalinosis. Tubules are obsolete. Stroma is sclerosed. Malignant clinical cause of hypertension illness. For the malignant clinical cause of hypertension disease, such characteristic as frequent hypertensive crises is present. It is sharp increase of arterial pressure, which rise up as result of spasm of arterioles. The morphologically Signs of crisis is gathering and destruction of basal membrane, location of endothelium as palin, plasmargy, fibrinoid necrosis of walls of arterioles, thrombosis. Heart attacks and hemorrhages are developing or in internal organs. Clinic morphological forms of hypertension illness. Depending on predominance of structural alteration of vessels in a certain pool and related to its clinic morphological change, select kidney, cerebral, and cardiac clinic morphological forms of hypertension disease. In this macroscopically picture present hemorrhage in the cerebrum. In a place of hemorrhage of brain is blasted with formation of cavity filled with convoluted blood. Dug up cerebral arteries comes as a rule during a hypertension crisis in the place of my microaneurysm. Ischemic heart disease. Names the violation of its functions, conditional, absolute, or relative insufficiency of coronary blood supply. In connection with large social meaningfulness of his pathology, it is selected ischemic heart disease independent nosology unit. Ischemic illness shows up in arrhythmias, ischemic dystrophy of myocardium, heart attack of myocardium, cardiosclerosis. Develops mostly, ischemic heart disease develops mostly for the persons of sex of men after 50 and occupies the first place in invalidization and death rate of patients with cardiovascular pathology. Ischemic illness pathogenetically is related to atherosclerosis and hypertension illness, and on the essence is the cardiac form with the general factors of risk. The ischemic illness can lead and other defects of coronary arteries, in particular at rheumatism, not periarteritis. Also, etiology and pathogenesis, risk factors of ischemic heart disease. Direct reasons of ischemia of heart more frequent, all is spasm, thrombosis or embolism of coronary arteries, and also function overload of myocardium in the conditions of sclerotic occlusion of these vessels. But there are only local factors of ischemia and necrosis of cardiac muscles. In the origin of ischemic illness as a cardiac form of atherosclerosis and hypertensive illness, an important role is played by the role of variable terms, hyperlipidemia, arterial hypertension, supplies mass of body, not mobile way of life, smoking, saccharine diabetes or diabetes mellitus, and gout, chronic emotional overstream, and inherited inclination. At combination for the same person during 10 of such factors as hyperlipidemia, arterial hypertension, smoking, and cephaloid mass, there will be ischemic illness of heart in the half of causes. These histological signs of morphological change in coronary artery by atherosclerosis. The coronary artery shown here has narrowing of the lumen due to a build-up of atherosclerotic plaque. Severe narrowing can lead to angina, ischemia, and infarction. As is signs of progression atherosclerotic change coronary vessels. There is a severe degree of narrowing in this coronary artery. It is complex in that there is a large area of calcification, was the low right, which appears bluish on this hematoxylinosin stain. Complex atheroma have calcification, thrombosis, or hemorrhage. Such calcification would make coronary angioplasty difficult. This microscopically signs atherosclerotic of coronary artery. Here is a coronary artery with atherosclerotic plaque. There is hemorrhage into the plaque in the middle of this photograph. This is one of the complications of atherosclerosis. Such hemorrhage could acutely narrow the lumen. This is coronary thrombosis, one of the complications of atherosclerosis. The dark red thrombus is seen in the arterial descending coronary artery. Here is the coronary thrombosis at higher magnification. The thrombose occludes the lumen and produces ischemia and or infarction of myocardium. This histological signs of coronary thrombosis is seen microscopically occluding the remaining small lumen of this coronary artery. Also, there are acute, sharp, and chronic forms of ischemic heart disease. A sharp form shows up ischemic dystrophy of myocardium, or stenocardia, and heart attack by necrosis of myocardium, myocardial infarction. Chronic variant of ischemic heart disease have morphological signs as cardiosclerosis. The last is diffuse small and large focus, or post-attack large focus. Sometimes cardiosclerosis is complicated by chronic aneurysm of heart. Also, one form of ischemic heart disease, clinic form, is stenocardia. Morphologically, stenocardia is characterized by ischemic dystrophy of myocardium. It is flabby in the focus of ischemia, pale and filling out. Histologically find out paresis of vessels, sometimes fresh blood clots, interstitial is swollen, red corpuscular disappearance of transversal bending cardiomyocytes, diapedesis, hemorrhages. Electronic, microscopic, and histochemical change are taken to diminish the amount of granules of glycogen, swelling, and destruction of chondrosome and tubules of sarcoplasmic net. These changes are conditioned by violation of the tissue bracing, staining of anaerobic glycolysis, breaking up of breathing, and oxidation phosphorylation. In development of destructive change of cellular organelles, an important role is taken by discharged catecholamines and to the change water electrolyte exchange, loss of magnesium, potassium, and phosphorus, but peeling up of sodium, calcium, and water. Myocardial infarction. Next form, acute form, ischemic heart disease. A long duration coronal spasm, a thrombosis or occlusion of coronal vessels are reasons of transition of ischemic dystrophy of myocardium in a heart attack. A heart attack of myocardium is circulatory ischemic necrosis of cardiac muscles. That is why expect for a change of electrocardiogram. Enzymia is a characteristic for it. Morphologically, it is an ischemic heart attack with hemorrhagic coronal. It is classified by the time of origin, by localization, distribution, and motion. Complete necrosis of cardiomyocytes is formed for a day long. At first, myocardium in the pool of the damaged artery is flabby, unevenly osculatory. Histologically, the accumulations of leukocytes appear in capillaries, emigration of them, diapedesis hemorrhages, relaxation of cardiomyocytes, disappearance in the loss of glycogen and oxygen, restoration enzymes. During next hour, the outlines of filling out cardiomyocytes become round, transversal, banding, disappearance. This histological signs morphological change in cardiomyocytes by myocardial infarction. This high-power microscopic view of the myocardium demonstrate an infarction of about first or second days in duration. The myocardial fibers have dark red contraction, bands extension across them. The myocardial cells nuclei have almost all disappeared. There is beginning acute inflammation. Clinically, such an acute myocardial infarction is marked by change in the electrocardiogram and by a rise in the myocardial traction of creatine kinase. This microscopically signs formation myocardial infarction. The interventricular septum of the heart has been sectioned to reveal an extended acute myocardial infarction. The dead muscle is tan yellow with a surrounding hyperemic border. This picture presents signs from developed myocardial infarction and in black color in front part. This histological signs myocardial infarction. In this microscopic view of recent myocardial infarction, there is extended hemorrhage along with myocardial fiber necrosis, with contraction band and loss of nuclei. Macroscopically, the area of heart attack especially appears only through 18-24 hours after the origin of illness. Necrotic areas acquires a gray-red color. It is eliminated the ribbon of hemorrhages, and sometimes something comes forward above the surface of heart as a result of edema. The phenomena of edema disappear in subsequent days. Necrotic tissue falls black, becomes dense yellow-gray. On periphery, demarcation below which consists of leukocytes is formed, fibroblasts and macrophagocytes. The last take part in resorption of dead masses, lipids, and tissues detritus accumulate in the cytoplasm. Fibroblasts take part in fibrinogenesis. The process of organization of heart attack lasts 7 or 8 weeks. Connective tissue emanates from the areas of demarcation from the round of the stored tissue in the areas of necrosis. New formed connective tissue at first is magnificent, as granulation after pass in rough fibrose. In it round it is island of hypertrophied cardiomyocytes appear. Investigation of this process is formation of dense scar, morphological basis of post-attack large focus cardiosclerosis. This macroscopically signs myocardial infarction. A necrotic area acquires a gray-red color. It is limited. There are ribbons of hemorrhages and sometimes something comes forward above the surface of heart as a result of edema. This macroscopically, this cross of section reveals a large myocardial infarction involving anterior left ventricular wall and septa. Microscopically, this myocardial infarction is about 3 to 4 days old. There is an extensive acute inflammatory cells infiltrate, and the myocardial fibers are so necrotic that the outlines of them are only barely fibrous visible. This is an intermediate myocardial infection of first or second weeks in age. Note that there are remaining normal myocardial fibers at the top. Below these fibers are many macrophages, along with numerous capillaries and little collagenization. Complication: myocardial infarction. The sharp heart attack of myocardium has the most frequent complication as cardiogenic shock, fibrillation of ventricles, asystole, sharp cardiac insufficiency, myomelisy, sharp aneurysm and break of heart, perital thrombosis and pericarditis. There is melting of myocardium in the case of predominance of autolysis of dead tissue, myomelisy. Myocardium in these causes is helpless to contract interventricular pressure of blood. Wall of heart is thickened 9 knobs outside. That results in formation of additional cavity, aneurysm of heart. Conversely, in it appears paritally blood clot. It covers the tears of endocardium and strengthens durability of wall. At insufficient thromboformation, blood penetrates under endocardium and necrotic tissue, which conducts hearts to the break. Blood is outpoured in the cavity of cardiac shirt, hemopericardium. Parietal blood clots rise up mainly at transmural and subendocardial heart attacks. They can be with a source of embolism, for example, of kidney vessels and other organs. At subepicardial and transmural heart attacks, there is reactive exudative inflammation, fibrinous pericarditis often enough. In this picture, present macroscopically signs post-infarction break of heart. You can see rupture wall of heart after infarction. In this picture, present macroscopically signs myocardial infarction with complication with rupture of wall of heart and formation hemopericardium or tamponade of pericardium. Cardiosclerosis makes structural basis of chronic ischemic illness of heart. It can be atherosclerotic diffuse small focus or can be development at hypertensive illness, and also post-attack large focus. Atherosclerotic diffuse small focus or at hypertension illness cardiosclerosis is related to hypoxia of myocardium. Connecting tissue replaces the place of dystrophy, atrophy, and dead cardiomyocytes, and also overgrowth in perivascular space. Macroscopically, such cardiosclerosis is presented as white perivascular layer and narrow ribbons in all of layer of muscular of heart. Post-attack large focus cardiosclerosis. Agonization of heart attack is completed by large focus cardiosclerosis. Sometimes it is a vast field of connecting tissue which take a layer of wall of heart. In such cases, it is thinned and knobs under pressure of blood and aneurysmatic sac appearance. This is histological signs cardiosclerosis. There is pale white collagen within the interstitium between myocardial fibers. This represents an area of remote infarction. Macroscopically, signs post-attack large focus cardiosclerosis. The wall of left ventricle is thickened. The muscles of heart is homogeneous. In the areas of apex, there is an haze of connecting tissue with unclear contours, which occupies the considerable area of transverse section of wall of heart is post-attack large focus cardiosclerosis. And this picture presents to high magnification macroscopically signs post-attack large focus cardiosclerosis, white color. These two macroscopically signs complication of myocardial infarction, the tan to white areas of myocardial scarring seen from the endocardial surface here represents of remote heart myocardial infarction. These two complications of myocardial infarction were formation of ventricular aneurysm. There has been a previous extensive transmural myocardial infarction involving the free wall of the left ventricle. Note that the thickness of the myocardial wall is normal superiorly, but inferiorly is only a thin fibrous wall. The thinning areas represents a ventricular aneurysm that has development as consequence of the Helen infarct. Such an aneurysm represents non-contractile tissue that reduces stroke volume and strains the remaining myocardium. The stasis of blood in the aneurysm predisposes to mural thrombosis. These two present macroscopically signed cardiac aneurysm after myocardial infarction. Cardiac aneurysm often occur in the left ventricle. It appears the function of the heart and is a site for mural thrombosis. Illness of nervous system, disease of nervous system, cerebrovascular disease. This pathology very often develop as a result of atherosclerosis, injury of vessels, or hypertension disease. Also, cerebrovascular disease is illness of cerebrum, which rise up on soil of violation of circulation of blood. In case of the large frequency of morbidity and death rate, they are selected in the independent group of diseases with a proper code in International Classification of Diseases. A background for them is atherosclerosis and hypertension illness, bone anomalies of development of vessels of brain, arthritis and hemorrhagic diathesis. Risk factor of cerebrovascular disease can be diabetes mellitus, atherosclerosis of coronary arteries, cardiac insufficiency, obesity, smoking of cigarette, alcoholism. Etiology and pathogenesis cerebrovascular disease. A direct reason: spasm, thrombosis, thromboembolism of cerebral and paracerebral arteries. A considerable place is taken as psycho-emotional overstream. Classification. cerebrovascular disease. Distinguished transitory ischemic encephalopathy, selective necrosis of neurons, ischemic and hemorrhagic stroke. Morphology cerebrovascular disease. As a transitory ischemia of cerebrum and an edema, dystrophic change is marked in nervous cells. Single cell hemorrhagia laying of gamma-siderin at chronic motion. This macroscopically signs one variant cerebrovascular disease, the extensive white matter petechial hemorrhage seen typical for fat embolism syndrome. Interesting neurological signs and symptoms usually appear about a week after the initial event, such as long bone fracture in a vehicular accident. Selective necrosis of neurons can have diffuse character or focus after the attacks of hypotension. Diffuse selective necrosis of neurons, which is observed as a stop of heart, leads to death of patient in a few days. Thus, in a cerebrum of displays of heart attack does not find only on microscopical level. Widespread necrosis of neurons appear especially in hippocampus, 5-6 layers of back of cerebrum. Focus selective necrosis of neurons rise up after the attacks of hypotension and often meets in areas between arterial pools of brain and cerebellum. The most remote from arterial vessels structures of cerebrum suffer. These microscopically signs change in brain by cerebrovascular disease. The neurons are the most sensitive cells to anoxic injury. Seen here are red neurons which are dying as a result of hypoxia. One of the most sensitive areas in the brain to hypoxic injury is the hippocamp and other part. In this picture, there are Purkinje cells between the molecular and granular layers of the cerebellum are also highly susceptible to anoxia. Those seen here have a red cytoplasm, incident cytoplastic body, and pyrolysis. An ischemic stroke rises up as a result of stopping of arterial blood supply of cerebrum through thrombosis of the atherosclerotic change vessels of brain. The morphological display of ischemic stroke can be ischemic, hemorrhagic, and the heart attack is mixed. In the mixed heart attack, it is possible to find the areas of both ischemic and hemorrhagic heart attack. Hemo frequent rise up in the gray matter of brain. At an ischemic stroke, circulatory ischemic necrosis, which looks as a cell of gray softening cerebral matter, develops in the brain. This macroscopically signs cerebrovascular disease, and acute cerebral infarct is seen here. Such infarcts are typically the result of arterial thrombosis or embolism. In this picture too present signs infarct of cerebral hemisphere, present necrosis, change in tissue of brain, yellow color. These two macroscopically signs infarct of cerebellum hemisphere, homogeneity, cerebrocephaly, gray color, change in brain, tissue of brain. In this picture, present macroscopically signs outcome of infarction of brain. The arteriosclerosis that result from chronic hypertension leads to small lacuna infarction or lacunas, one of which is seen here in the pons. Such lesions are most common in basal ganglia, deep white matter, and brainstem. These histological signs. This is a microscopic appearance of lacuna infarction. Note that it is a cystic space from the resolved liquefactive necrosis. There can be hemosiderin pigment from hemorrhage as well. In this picture, this intermediate infarction of the frontal lobe shown liquefactive necrosis with formation of cystic space as resolution begins. These two macroscopically, here is a cerebral infarction from an arterial embolus, which often leads to a hemorrhagic appearance. There is edema which obscures the structures. The acutely edematous infarcted tissue may produce a mass effect. Note the decrease in size of cerebrum. Histological. This is cerebral infarction demonstrates the presence of many macrophages at the right with in the upper, which are cleaning up the lipid debris from the liquefactive necrosis. This two histological resolution of the liquefactive necrosis by macrophages in a cerebral infarction over weeks leads to the formation of a cystic space. Macroscopically, here is a large remote cerebral infarction. Resolution of the infarction has left a huge cystic space encompassing much of the cerebral hemisphere in this neonate. Macroscopically, a more cerebral infarction is seen here with a residual cyst phase after resolution of liquefactive necrosis. The resulting Wallerian degeneration has decreased the descending conchispinal tracts and the cerebral predes of the brain. Hemorrhagic stroke. Shows are by intracranial hematoma, hemorrhagic impregnation of tissue of the cerebrum, subarachnoid hemorrhage. A spontaneous intracranial hemorrhage often meets at hypertension, cerebral hemorrhage, and break of aneurysm of arteries, subarachnoid hemorrhage. Reason of spontaneous intracranial hemorrhages can be bleeding at the sharp leukosis, hemorrhage in the tumor of primary or metastatic origin. Cerebral hemorrhage, hemorrhagic stroke, cerebral apoplexy develops at the break of microaneurysm of artery, which is often formed for patients with arterial hypertension. As the hemorrhagic stroke, saturating with blood of the damaged area of brain is marked additionally with development of hematoma of brain. In the place of hemorrhagic tissue of brain collapses and is softened red softening to the brain. In the first day, a cerebral hematoma is an area of brain which is presented by the blasted matter of brain from here. Macroscopically, here is an incidental non-ruptured berry aneurysm located at the bifurcation of the left middle cerebral and arterial communication arteries of the sickle villus at the base of the brain. This aneurysm may be present in 1% of person. They form at points where there is a development weakness in the arterial wall. In this picture present multiply aneurysm, the cycle of Willius. The cycle of Willius has been dissected and 3 bari aneurysms are seen. Multiply aneurysms are seen in about 20–30% of cases of bari aneurysm. Such aneurysms are congenital in the sense that the defect in the arterial wall is present from birth, but the actual aneurysm takes years to develop, so that rupture is most likely to occur in young to middle-aged adults. In this picture presents subarachnoid hemorrhage from a ruptured aneurysm is more of the irritant producing vasospasm than a mass lesion. In this picture macroscopically signs subarachnoid hemorrhage. This presents signs of hemorrhage in the tumor of brain. This hemorrhage in the ventricle of the brain. Very often after such hemorrhage, patient death. These 2 hemorrhage in ventricle in the brain, outcome death. As hemorrhage in the trunk of the brain, 2 very often death patient. Hemorrhage in trunk of the brain and ventricles, very often death. This is 2 hemorrhage in the brain, a result of hypertension illness. These 2 hemorrhage in the brain, 2 result of the hypertension illness. This is cerebral hemorrhage occur in connection with the overdose of cocaine. Such acute hemorrhage can occasionally be seen with cocaine use. The orange-brown scalloped appearance of this lesion is consistent with old contusions. The resolution left behind hemosiderin from the hemorrhage that products the orange-brown. Hemorrhage in the brain. The large hemorrhage in this adult brain rose in the basal ganglia region of a patient with hypertension. This is one cause for a stroke. Infection, disease of the nervous system. Festering infection in the cerebral causes meningitis, inflammation of this space, or encephalitis, inflammation of tissue of cerebral. After localization, meningitis can be pachymeningitis is inflammation of heart-brain tunics, leptomeningitis is inflammation of vascular and arachnoid. Leptomeningitis arise up after penetration of infection. Meningococcus, pneumococcus, intestinal stick is in a subarachnoid space. Characteristic is a gametogenic infecting and eye drop way of infection. At morphological research find pores in subarachnoid intracranial and spinal space, at Kringl's hemispheres, and on the basis of brain. In ventricular are turbid cerebrospinal liquid, fibrin, pus, appearance on walls, and vascular interlacement hydrocephaly. Thank you very much.